Hello, my name is Dr. Jessica Chapman. I'm a board-certified rheumatologist practicing in upstate New York. And today I'd like to go over how to inject Humira at home. So Humira is a very commonly used medication in individuals that suffer from various rheumatic and non-rheumatic diseases. So in the United States, medications have to be FDA approved. And Humira has FDA approval for multiple autoimmune diseases. So these include rheumatoid arthritis, plaque psoriasis, psoriatic arthritis, ankylosing spondylitis, juvenile idiopathic arthritis, Crohn's disease, ulcerative colitis, and the pediatric forms of these diseases, as well as hidradenitis suppurativa and non-infectious uveitis, or certain forms of it. So grab your pen and let's get to it. So before you start anything, what you want to do is make sure that you have all your gear set up before you start injecting. So you'll want to have the Humira, alcohol prep pads, as well as something to wash your hands. So this can be hand sanitizer or good old soap and water. So you'll start off by taking the Humira and making sure that it's not expired. You also want to make sure that the integrity is okay. So you'll find a little window on the side of the pen. It should be clear, colorless, sometimes a little bit yellow. That's totally normal. If there's a little bubble, that's also normal. But if it's really cloudy or you see some precipitates, that's not normal, and you should not inject when that's there. Simply contact either the pharmacy, manufacturer, or your doctor so that they can send you a replacement pen. So if everything is fine, then you can go ahead and proceed with the injection. Now, if you have an infection, it's important not to inject. And in terms of where to inject, well, typically we inject on the thigh, the abdomen, and if someone else is doing it for you on the deltoid. You want to try to rotate the injection sites as much as possible. And if you're using the abdomen, you want to be at least an inch or two away from the belly button. All right, so first things first, you want to wash your hands. That. Now, I can't really inject my abdomen or my thigh right now, so I'll use my arms, so it's not exactly perfect technique, but it'll do for now. So let's say we use my forearm, so you'll want to wash the area. If you have a rash, don't inject through the rash or mole. Like, you want to have just normal skin. So you can have it just dry up a little bit so it doesn't sting as much. The pen you want to leave at room temperature for about a half hour to an hour before you actually inject. All right, so AbbVie makes it easy. So you have one, take the first button off. This is where the injection is, so this is where the needle is. And then number two is the trigger. So what you want to do is hold the pen almost like you're going to stab something. You want to keep your thumb away from the trigger until the last minute. You'll have to squeeze the skin and then basically at a 90-degree angle just press down. Obviously, I can't do everything at the same time because I'm using my arm, but you get it. So 90-degree angle. And when you're ready, you pull the trigger and you just wait 10 to 15 seconds. You'll see a plunger go down in the window on the side. When it's at the end, you know you're ready. And that's it. Once you're done, you can put this in a sharps container. If you don't have one, you can use an old can of coffee or something like that. And then once everything is full, you'll have to bring it to a sharps disposal center. But there are some
programs that you can sign up to online, where you basically mail it to a company that knows how to that basically disposes it for you. Don't put it in the garbage. You know, it is a sharp. That's about it. You can put a little bit of Band-Aid if you want to or not. It doesn't really matter. And that's about it.
So that's Humira in a nutshell, how to inject yourself with the medication. If you have any specific questions regarding your case, I would highly recommend that you discuss this with your rheumatologist or your physician. And if you have any general questions regarding Humira or any topics that you'd like me to address in future videos, please leave it in the comment section. Otherwise, like and subscribe, and I'll see you next week.